Gail, but really for anybody who has injured their lower backs. And when I say injured, I mean we would refer to this as slipping a disc. Otherwise, a chiropractor or a physio might say that your L4 or L5 disc is bulging. Basically what it means is that it's obviously slipped out a little bit and it's now inflamed, so it's unable to come back in. So you do actually experience quite a lot of pain and a bit of immobility. So I'm just going to show you a couple of very easy stretches just to try and release it. Sitting or lying down for long periods normally makes it very stiff and sore, so you do need to try and make sure that you keep moving. Being on your feet and walking around is probably the most comfortable position. But if you can, once you get to a point that you're able to move a little bit, the first day, first 24 hours, sometimes you can't really go up and down. You just need to put some ice on it. But once you feel like you can hold onto a chair or a table and lower yourself down so that you get onto your all fours. And once you're on your all fours, the first thing you do is just a little cat stretch. So you might find that that's the sort of range of motion that you've got in the beginning, which is fine. And then you just release. And again, tuck. And if you can, you want to take your head and neck and chest in as well. And then slowly release. And just take it easy. Just work through the motions of the stretch, just going as far as you can. Pause there and hold it for a moment before releasing back out. You will feel an intense stretch down in that area when this happens. So don't push it. Don't force past that point. Just go to where you can and then just hold it for a little breath. So as you keep going, you might find that you can go a little bit more and start getting more tuck under with the bum, and you just go, and you can't do too many of these, to be honest. So you can do 10, you can do 15, just working your way up. You might start really small down here and then eventually build up that you're doing a full cat stretch. Okay, if you need to get back up again, hold on to something and go up with a straight back. Don't try and climb up like this. You want to try and come up and then use something to help you to get back up. But before getting back up, we want to go around and just swing the legs so that you can lie down on your back. The next one is just your normal pelvic curl, but again, you're just keeping the range of motion of everything a little smaller. So, from your elastic of your pants, all you're going to work on first is the pelvic tilt. So that's it, just tilt and release. Tilt and release, that's all you're going to do, just lift. So it's just tucking the tailbone a little bit in the bum and release. And when you do, try and pull the belly button in so that you're pushing the lower back into the floor, and it's just that little pelvic tilt. So basically you're doing the same motion as you did with your cat stretch. You're rounding the spine and pushing the spine into the floor as you tuck, and then just releasing out. So it's more about mobility than it is stretching at this point. And then obviously as you get more and more comfortable, you can start to lift a little higher and go down, but you really don't need to, hey? You really don't need to lift. Just go to where you can, and you can do it a bit slower than I'm doing it as well. You can sort of hold it for a moment and then ease and gently go back down. And again, tuck, and just hold it for a moment, and very slowly just sort of roll down one vertebra at a time. Good. Once you've done that, if you can manage, you're going to lift one leg and put it up into your chest. Good. Holding that knee there. I'm just going to dress myself again. Holding that knee there. And now if you feel like you can slowly slide this bottom leg away. You don't have to go all the way flat, guys. You can just keep it here. Just do what you can do. And then when you release, just be careful. Holding the tummy muscle when you change and go to the other leg as well. Just moving slowly and always work within your range. You can't push yourself to go further than you should, hey? Stretching that leg where you can. You don't have to be flat all the way out. Just to where you can. And that just releases the insertion into the back of the hip joint as well. Good. And as you release, you just bring those feet gently back down. So that's a really good place just to start for the first sort of 48 hours, just to do those three, and you will feel it sort of releasing over that time, and you'll be able to do more and more. Things like a roll down from a standing position is just going to be quite painful in the beginning, but after 2 or 3 days you can think about doing that. Sorry, you're going to lose my head now, but you can think about doing it, but then you're going to need to bend your knees, okay, when you do that. And just go to where you can. As I say, this is only after about four days. and then just coming back up. And you're going to have to keep bent knees and just take your time. Alternatively, you can also put your hands on your knees once you can get into this position and just do that tuck and release and that tuck. Good. Just that little bum tuck under. It's the same as your cat stretches you did earlier. You're just doing it here. Some people also like to do it on the wall, so that when you roll your shoulders forward, you've got the support of the wall. So just rolling halfway and then roll back up the wall. Good. And again, nodding the chin to the chest, rolling the shoulders forward, and as you go down, try and feel the small of your back pushing into the wall, and that's where you'll feel that big stretch. So you just want to hold it there and then release back up. But as I said, this is not on day 1 or 2. This is only after about day 3, maybe day 4, and stretch, tuck your chin into your chest, push your lower back into the wall, and roll back up. So I hope that's helpful to try and help you just release a little bit of the lower back tension. It might be good for a couple of you who just have tight and sore lower backs as well. It's just a nice, easy, gentle release into those stretches. So good luck. Enjoy.